William Todd.
All right, today we're joined with Dr. William Todd Smith. He's an orthopedic sports medicine doctor here in Starkville, Mississippi.
Correct.
So first off, where is it that you call home, and which schools have you attended?
I went to a small private school in Mississippi, in South Mississippi. I went to the University of Mississippi for undergraduate in Oxford, and then I went to the University of Mississippi School of Medicine in Jackson. I did a 6-month fellowship in Johnson City, Tennessee, associated with East Tennessee University, and that's it.
Okay. What made you want to just become a sports medicine doctor?
In orthopedics, when you do orthopedics, you can do a lot of things. You can do hand, you can do spine, you can do joint replacement, you can do foot and ankle. So you can kind of specialize in the areas that you wanted. I've always been athletic. I like athletes. And so to me, that was just a reasonable kind of pathway. When you deal with sports medicine, you know, it's a very goal-oriented kind of population that you deal with. They become injured. They want to get back to the level of play, so they're very highly motivated, and they usually will want to do what you ask them to do.
Okay. Can you just describe your journey from the beginning to where you're at now?
As far as education?
Yeah, it's just the beginning.
Well, I mean, it's you know, it's your high school graduation, and then from there it's 4 years of college. From there it's 4 years of medical school. From there it's 5 years of orthopedic training, and then if you want to subspecialize, then it's an extra year. So you usually are looking at 6 years of further training after you finish medical school.
Okay. Can you share a memorable story, you know, from med school or undergrad?
In pertaining to what? Guiding me into orthopedics, or
Just anything memorable?
oh, there are lots of memorable things. I guess as it pertains to orthopedics, in my residency, we got to take care of a lot of college athletes that would come through the university with these complex injuries, and probably one of the most gratifying was seeing a college soccer female athlete who had torn, I think, about every ligament in her knee that you could. She underwent her surgery, she rehabbed, and within a year she sent us a picture of her back on the soccer field playing at the same level that she had before she injured her knee.
Mm-hmm. What motivates you?
Well, in private practice, you have to be motivated to come to work every day. You have to be motivated to give your best even when you're tired. With healthcare changing the way it is, you have to be motivated because a lot of your reimbursement and payment models are modeled after patient outcomes. So if you're not motivated to give your patients the best care they need, their outcomes are not going to be what they need to be, and subsequently your reimbursements are not going to be what they should.
Okay, can you just describe a typical day at work for yourself?
Usually starts about 4:30 in the morning. I'll usually get up, and on a surgery day, I will review the MRIs, the studies of people that I have to operate on that day. Usually in the hospital by 7, you need to meet the patients that you're going to operate on that day. Your day in the OR starts about 7:30. Usually ends around 3 or 3:30 in the afternoon, and then I usually come back to the clinic and follow up on any patient calls with my nurses and staff. And then in the evenings, usually try to call and talk to your patients that you've operated on that day. On the clinic days, clinic usually starts around 8 o'clock, usually goes to about 4. And then on the days that you're on call, which means you have to cover for any injuries that may come in, you know, sometimes you're operating into the night, despite having to do that same routine the next day.
Mm-hmm. Okay, and then last question here. Looking back, what are some things you wish you had known?
Yeah, I wish I'd have known how healthcare was going to change over time. I wish I would have probably spent more time with family and friends during your training. If I had it to do over again, I probably would, but I would make those changes along the way.
Okay. Well, thank you for meeting with me today. I know you have a very busy schedule. Thank you. It's been a pleasure.
Yep. Good luck.
Thanks.